Hi everyone. This is a continuation of the introductory video lecture on hydrotherapy. So previously we learned basically the physical properties of water. So according to that physical properties, we will have specific physiological effects in the human body. Okay, and these physiological effects, they can affect the musculoskeletal system, the cardiovascular system, respiratory system, urinary system, the limbic system, which is more related with emotions. So think about patients with some degree of cognitive impairment that they could, water like could be a playful intervention for their for the improvement of cognitive tasks. For example, in a child with autism, okay, so this could enhance somehow um, their cognition, okay. And finally, cleansing wounds, okay. Cleansing wounds is a particular aspect of hydrotherapy because obviously we wouldn't think about cleaning a wound in a swimming pool, okay. So in a public swimming pool which we share with other people, okay. So cleansing wounds is more specifically for small tanks, okay, that the person uses individually, okay. So this tank will be used once, okay, for one person, and then the water will be removed, the tank will be sterilized for the next use, okay. So this final bullet point here is more for, is specific for individual use, not for shared use of hydrotherapy, okay. Um, the musculoskeletal effects, they are mainly obtained by buoyancy, okay, because of this physical property. As we learned, buoyancy is an upward thrust, okay, that the body experiences when it is immersed in water. Okay, so buoyancy unloads weight-bearing anatomical structures and allows patients to perform exercises with less trauma and pain. Okay, so according to this picture here at the top, sorry about here, my face is covering the picture, but you have the same picture in the PDF. Um, we have here weight-bearing with immersion. Okay, so if our body is immersed at the level of the neck here, for example, C7, we have only 10% of weight bearing. So we can minimize 90% of the body, of the weight of the body, okay? And we only bear on 10% of the weight when the water is at this level here, okay? We have the xiphoid process. Water at the level of the xiphoid process, we have 33% of weight bearing, okay, approximately. And at the level of the anterior superior iliac spine, we have 50% or half of the weight bearing in our body, okay. So considering these characteristics of loss of weight bearing, this could be potentially useful for a number of musculoskeletal conditions, including patients with obesity or arthritis, ligamentous instability, traumatic or degenerative periarticular conditions, osteoporosis, for example, in which the patients they have to avoid high impact on their joints. So water could be potentially useful for these conditions. The water resistance can be used to maintain or gain strength in patients with neuromuscular conditions as well. Okay, so according to the resistance, okay, so we have buoyancy is a physical property, and resistance is another physical property that could also help to maintain or gain muscular strength here, okay, by doing exercises against the resistance of the water. We also have cardiovascular effects. Cardiovascular effects are promoted mainly by hydrostatic pressure, okay? So as we learned, the hydrostatic pressure is higher in the lower limbs when someone is immersed, like in this picture here, at the level of the neck, okay? So this hydrostatic pressure exerted on the distal extremities with upright immersion enhances the venous return, the stroke volume, and the myocardial activity. So this hydrostatic pressure will displace the venous blood proximately, okay? Then more blood will arrive at the heart, okay? As you all remember, in physiology, we have the Starling effect, okay, the Starling law. What does it say? The Frank-Starling mechanism. The more cardiac volume is present here in the ventricles, more specifically, okay, when the ventricles are full of blood, what happens? It stretches the walls of the ventricles, okay, and this activates receptors located in the myocardium, and this will signal an increased force of contraction of the ventricles, okay, so the more volume of blood we have in our ventricles, the more will be the contraction force of the ventricles. So more blood will be ejected from the heart. So when increase the cardiac volume, we increase the stroke volume and the cardiac output. Okay, so this when the water is at this level here at the neck, so we are covering the chest wall, okay? It is believed that we increase in 30% the stroke volume, okay, and the cardiac output in this condition. We also have respiratory effects promoted by hydrostatic pressure. This pressure on the chest wall increases the resistance to lung expansion, okay? So the lung workload challenge can be used to improve cardiorespiratory fitness. So we have here hydrostatic pressure is compressing the chest wall, okay? This will also increase the circulation in the chest cavity, okay? This will decrease the vital capacity because the chest is compressed, so the lungs, it's harder for the lungs to expand, okay? And this this will affect the work of breathing, okay? So it will be higher. The workload to breathe will be higher under the water, okay, when our body is immersed. So this can be used to improve cardiorespiratory fitness, to improve the chest wall muscles, okay? It can be very useful. But bear in mind that caution should be taken when the patients, they have respiratory or cardiovascular impairments like asthma, for example, or cardiovascular diseases. Any patient that has respiratory or cardiovascular conditions, they must be monitored, okay, under the water, so we can have control of their blood pressure, okay, their saturation, oxygen saturation, etc. So this is the only thing that the caution that we should take when we have patients with respiratory conditions or cardiovascular conditions under the water, okay? We know these physiological effects, but even though we must monitor these patients. We have also renal effects caused by hydrostatic pressure. This will increase the renal blood flow, okay, and decreases, and finally will decrease the antidiuretic hormone, ADH, and aldosterone production. So we have here increased renal blood flow, okay, caused by increased hydrostatic pressure. We have increased central blood volume, including the renal blood flow, okay. This, when we have more renal blood flow, we'll have more renal activity, okay? So more filtration will occur, okay, in our kidneys. So therefore, we'll have more urine production and also solutes, okay? Sodium concentration and potassium concentration in our kidneys. So the function of the antidiuretic hormone is to prevent urination, okay? So when we have decreased antidiuretic hormone and decreased aldosterone hormone, we will have more urination, okay? Because this aldosterone is also linked with the retention of salt, okay, of sodium. So when we have more sodium, we have more water, okay? And in this case, when we have less sodium, less water, consequently, okay? So this may be also beneficial for patients with hypertension or peripheral edema, okay? So someone with edema, when this person is under the water, edema can be reduced because of this mechanism, okay? So that's the reason why most of us, when we are swimming for long periods in the swimming pool or in the sea, we have that willing of urination, okay, because of the increased renal blood flow. We have lots of uses in hydrotherapy, okay? Exercise and water can be beneficial for a number of different conditions, such as orthopedics, neurological rehabilitation, cardiorespiratory fitness, pregnancy, age-related deficits. As you see here in this table, we have all the conditions, musculoskeletal, okay, and also neurological problems, okay, including cardiorespiratory fitness, pregnancy, asthma. For asthma, it can be useful as well because of the humidity of the water. Okay, so it's believed that the humidity of the water lessens the symptoms of asthma. Okay, but caution should be taken as well with asthma because of chlorine, because in the swimming pool we have chlorine, and if the concentrations of chlorine are high in the swimming pool, this could exacerbate asthma symptoms, okay, because of the concentration of chlorine. So only make sure that chlorine is in acceptable safe levels in the swimming pool. Okay, and also is beneficial to the elderly population. Here we can see some examples of exercises in the water, using paddles to increase the resistance. We can use closed chain exercises or open chain exercises as well, moving the feet, the legs here. And regarding the red flags and precautions, overall hydrotherapy is safe, okay? But the contraindications would be bowel or bladder incontinence. So people who are unable to control voluntarily their intestines or their bladder, they are not it's not recommended for them. It's contraindicated actually to use the swimming pool if you cannot control the intestines or the bladder. Tracheostomy as well, because this is an open orifice that we put like a device here in the trachea. Okay, so this is contraindicated as well because patients, they could aspirate water through the tracheostomy. Infectious diseases as well, because the swimming pool is a shared environment. Um, Cardiac instability, so this is more related with severe decompensated congestive heart failure. Okay, so someone with this, when the cardiac instability is decompensated, okay, in case of a congestive heart failure, this is contraindication. But on the other hand, we also have other types of cardiac instabilities. So, for example, uncontrolled blood pressure. In case of uncontrolled blood pressure, it is recommended to monitor these patients, okay, when they use the swimming pool. Uncontrolled seizures, this is more related with severe epilepsy. Okay, so this is contraindicated. And also respiratory compromise, when the vital capacity is less than 1 liter. So because you know the physiological effects of chest compression, and this reduces the vital capacity. So if someone has this compromise in their vital capacity, so this is forbidden as well, okay, to use the swimming pool. And the precautions are aspiration risk, okay, catheters. So catheters, patients with catheters, they must have the catheters clamped, okay, so this will be safe for them to use the swimming pool. Cognitive impairment, this is a precaution because if someone doesn't understand the instructions, this could be, they could drown, okay, in the swimming pool. So cognitive impairments is a precaution, so they must be monitored as well, okay? So 100% of the time monitored. Tetraplegia or high paraplegia, this is because depending on the level of the spinal cord injury, these patients, they could have compromise in their thermoregulation. Okay, so they could not tell, for example, if the water is too hot, they could have some reactions to increased temperature of the water or decreased temperature of the water as well. They could have hypothermia, okay, in these cases here. Open wounds, it's a precaution. So if the wound has a waterproof dressing, the patient could be allowed to enter the swimming pool with an appropriate waterproof dressing over the wound. Okay. And dry skin or skin rashes or rash, this is also a precaution because this could potentially increase the dryness of the skin. Okay. So we have like a number of different possibilities of doing exercises in the water, as I showed you, open chain exercises, closed chain exercises, or using paddles. This is another intervention that is very much used in hydrotherapy. Okay, this is called the Ragaz ring method. Okay, so this is a technique that was developed first in Switzerland. Okay, and this is based on proprioceptive neuromuscular facilitation, PNF. You will learn this in next year in neurology. So this is a neurology technique. This method uses it's based on the principle that we could transfer the energy from the healthy muscles to weak muscles. Okay, so the Ragaz ring method recruits weak muscles by overflow from strong muscles. So we can think about patients with stroke, for example, if they have hemiplegia. Okay, so if one of their sides is weaker than the other, so we could use the strength from the healthy side to to the weak side. Okay. In this technique, basically, the patient lies horizontally on the surface of the water, and we also use floats over the neck, over the waist, or the legs as well. Okay. It enhances both the active and passive range of motion with the goal to improve neuromuscular function, okay, using therapist-assisted resistance. So the patient floats on the surface of the water and the therapists help on exercises to resist the movement for certain muscles. Here we have some examples, okay, so of the position of the therapist and the patient lying horizontally always, okay. And we can work different muscles. In this case here, the first picture, uh, we can use resistance to legs, for example, to leg extension using diagonal patterns. That these patterns, they are more specific related to um, proprioceptive neuromuscular facilitation, PNF. Here we can also use work the core muscles, okay? This position, doing lateral flexions of the trunk, or even working the arms as well, using the therapist assisted resistance. We have another method that this is Watsu. Okay, Watsu is water shiatsu. So this combines passive stretching and massage techniques under the water, warm water at 35 degrees Celsius. So in this technique, the therapist cradles the patient, as you see here in this picture. Okay, this is like very relaxing position, and with warm water, this is believed to increase the patient muscle relaxation and also pain relief. Okay, and here no floats are needed. The physio cradles the patient over the surface of the water. Okay, and does like these movements of stretching and also some massage under the water. Those are the aquatic equipment necessary for the application of hydrotherapy. Um, so we can divide this aquatic equipment in safety equipment and also in exercise equipment. So first of all, the safety equipment. Hydrotherapy is considered safe, okay? But to be safe, we must monitor these patients, okay? So in a way that let's say the most potential adverse effect from hydrotherapy would be drowning. Okay, so the physiotherapy technique should be safe to avoid drowning. Okay, so we don't want our patients to drown. So those are the equipment that we use in hydrotherapy. Life vest jacket, rescue tube, or this shepherd's hook. In case of drowning, we can rescue the patient, okay, or the person. Um, these floating life-saving ropes as well. So those are buoys, are considered safety equipment. And exercise equipment, we also have like many different exercise equipment that you can see here in these pictures: flotation cuffs, pull buoys, vests and belts, kickboards, water dumbbells, boots and belts. Okay, so this is what we mainly use in hydrotherapy. Okay, so this is it for now. Thanks for watching, and I see you soon.